Students should choose to study at Newman University for a number of reasons. Firstly, the university's values. They're all about community, they're about partnership, they're about social justice. That's a really, really good starting point for anybody that wants to come and study a healthcare-related degree. We spend a lot of time with service users, carers and their families, working in partnership with a variety of different professionals. So we'll make sure at the university and within the School of Nursing and Allied Health that those shared values are front and centre of the students' education. I think one of the things that we're going to be able to do within the School of Nursing and Allied Health is really provide students with a personalised approach to their education. That's something that the university does very well. They do very well in the league tables in terms of that extra support that students get. We're very aware that people come into nursing and physiotherapy, into other programmes, often because they've had a lived experience or they've supported a family member or a relative or somebody else that they know where they might have seen nurses or physiotherapists or other health and social care professionals acting in a way as a role model. And what we want to be able to do is to look at those smaller class sizes that we will have and really looking at that individual learning experience so we can identify where students are doing really well and they're really growing and they're exceeding. Also where students might need a little bit more encouragement and support, and being in a smaller group will enable us to do that. I think the things that we are really looking at is that element of partnership. That partnership of the relationships that the students are going to have with each other, with other professional programmes across the university, with practitioners and educators within the clinical environment, but also with the public. We really, really want to make sure that our programmes within the School of Nursing and Allied Health are all about citizenship. They're about working in partnership with the service users, carers, the population, the local communities. And our students are going to come from those local communities. So that element of us making sure that our practitioners and the ones that we are producing in the future represent the public that they're going to be coming and they're going to be caring for. That's really, really important to me as the head of school and to my colleagues that I'm working with. Interprofessional education is going to be front and centre, so that working with the other departments and the other programmes that we've got in the university. We have some really unique programmes here at Newman University. So for example, we've got the professional policing programme, we've got the counselling and psychotherapy programmes, we've also got some of the other programmes looking at theology and hospital chaplaincy. You don't often get all of those professional programmes in the same place at the same time. Clinical simulation and the clinical education that the students are going to get here in our state-of-the-art facilities is really going to make coming to study here quite a good and outstanding experience. I think the nursing students that are going to be studying here at the university are going to have lots and lots of opportunities. So I think those opportunities of learning with and from one another throughout their programme is going to be really, really important. Our programme is going to be based around something called experiential learning. That's all about getting students to think about some of those experiences that they've had, both prior to joining the university, but also as they move through our programme. As they go out into the clinical area, they'll be coming back into the university and we'll be getting them to reflect again on what worked well, what didn't work well, and then looking at their education in a really structured way to enable them to get those building blocks as they move from one subject to another. Human beings are not decompartmentalised, our curriculum can't be structured in that way. It's got to represent human beings and how we behave and how unpredictable we can be, but what happens when we become unwell, whether or not that's due to a mental health illness or whether or not that's due to a physical health illness. So our programmes need to reflect that, and we're working with our practice learning partners at Experts by Experience, other departments across the university to make sure that the learning experience for the students and the programme that they're going to undertake here, as I said, will be tailored to their needs, but meets those outcomes that we need them to meet for the Nursing Midwifery Council.